for being with us, Lisa.
Thank you for having me again, Jeanette. This is great. Always fun to talk to people about what we do and what can be helpful for them. So they are getting the handouts after. Is that right? Okay, awesome. So what we're going to do is go over a little bit of how trauma affects your body, and then talk to you about what we give our clients in terms of helping things to move through you that may help a little bit in recovery. So we're all traditionally trained physical therapists, but I kind of went in a different direction a long time ago. I always wanted to see what I can do to help patients truly heal from the inside out. And we have worked with clients from infants through clients in their 90s. And people seek us out because they want to deep dive into what's going on with their bodies. American medicine, which is fabulous, but as you all know, it's traditional American medicine is allopathic, meaning the problems and the solution come from outside the body. We have a more integrative approach, a more osteopathic approach, a more functional medicine-based approach, which is the call is coming from inside the house. So for us, what we're looking at is what happened to the body, what has it been through, and what can we do to help our clients to heal more from an inside out area. And we work a lot with patients who have had any manner of different things. We work on very complex clients. So throughout the course of treating complex clients, we've all run into, you'll run into mind-body issues. You're going to run into all kinds of things because everybody has had some type of trauma. So a lot of our work is based on how can we get the body to move through something or move it out so it will not affect you and cause problems. Does that make sense so far? So with all of our clients coming in, we're looking at how much of their problem issue is structural, meaning we look at every artery, lymph, nerve, vein, organ, everything, the biomechanics of every tissue in the body to see what's loaded. We often have patients come in who have had prior trauma, physical trauma that was never reset, and that's causing problems later on. We look to see how much of what's going on with the patient is physiological trauma. We are seeing more and more long COVID. We're seeing a lot of people that had major reactions to the vaccines, major reactions to COVID. They've ended up with POTS, complex regional pain syndrome. We're seeing a lot of very complex cases from COVID and the after effects of that. So that's more of a physiological trauma on the body. And then we also look at energetic trauma. So child abuse, any type of trauma that you've had in your life that kind of got you in an energetic way, something that you've been through that was traumatizing. We work with extremely patients who have had extreme trauma histories. We have a trauma-informed practice here. So a lot of that is how do you move that energetic input into the body, out of the body as well. So a lot of our work with our clients is how do we help their body reset to a better neutral? And basically whatever happened, how do you make it unhappen? So for us, whatever the client is coming in with, we look at it as a creative challenge. We're like, well, how did that happen? What is the presentation we're seeing now? Why is the body doing that? Because we assume that everything the body's doing is for generally its own protection. And we just think everything's absolutely fascinating. So any patient coming into us, especially complex, because we love complex cases, we love trying to figure out, okay, what has happened here and what can we do about it? So we're like little body detectives. And again, as we know, American medicine, which has its strengths, of course, is very physiology based. It does not look at structure the same way structure is looked at in Europe. My classes are part of a program in South America and Venezuela. So a lot of other parts of the world are much more touchy-feely than the US, especially in the realm of physical therapy. So our hands are on our patients the entire time of the visit. We are full on hands-on, and the hands are really helpful to figure out what happened and then what can we do about it. So for us, we're looking at the body and the fascia of the body to help us to tell the story of the body. What has this person been through? And it's the story of your body that's held in your fascia that will help us figure out how we can help you to move forward a little bit. So especially with our patients coming in with complex trauma, long COVID, Lyme. We see a lot of Lyme patients, and then complex regional pain syndrome, POTS, post-concussion. When we see complex cases, you have to have a way to kind of deconstruct the situation to figure out what to do. And we read the fascia. So we're basically little fascial whisperers. And our job is to put our hands on and get the information that we can from the body. Labs are great. Imaging is great. All that's great. There is also an entire world of fascia in the body that will tell the story, often before things will hit the labs, and also often when things will not even hit the imaging. All my clients with Parkinson's have clean MRIs, and yet they have major problems. So there is a whole world of fascia that is where we swim. So when people come to see us, they're looking for, what can you do in my body? How can you work with me in order to help everything else I'm doing to work better? So one of the things, again, that we work on is various degrees of trauma. And with all of our clients, most of them, we give them, when they can take it, a hands-on thing to do at home to help the body to heal more in between sessions. Because we say we're with you an hour a week or however long a week, but you're with your body all the time. And the hands are extremely helpful on the body, believe it or not, to help things to move. So we do have a handout you're going to be getting, which is how trauma affects the body. I feel like, let me go through that for just a couple of minutes, and then we'll get into the fun stuff, which is the hands-on stuff. So again, anything is considered trauma when it's hard for your body to shake it off pretty quickly. So something that sticks, right? So I have treatment tables that we treat on, and I'm constantly hitting my knees on them. So is that considered trauma? Not really. It's a little thing. It's no big deal. It's not that bad. But if I fall, we had a patient's mother just fall and shatter her kneecap. So that is trauma. All right. Trauma is something that really gets in there and loads the tissue. And we function as little physicists, and we're always looking for physics and how that's interacting with the body. So what we're looking for in terms of these trauma loads are things of a degree that locked down the fascia enough. It's called fascial load or fascial drag that can be causing problems in another area. So how we're trained is to feel the fascia, do a fascial map, and find what's called the primary, with which there may be more than one, to figure out, okay, here's your where you're feeling it, but that may not be where the problem is coming from. So we don't want to be wasting our time chasing a symptom. We want to be finding an area where the trauma is actually like happened. So we find many, many times, especially with our patients with POTS and complex regional pain syndrome, where the symptom is may not be where the original problem is. And the way you can find that is with the fascial map. So again, trauma is identified by, generally, is something that kind of happens to you that you can't just shake off very easily. It tends to stick, whether it's COVID or, car accident or concussion or, some type of psychological trauma and abuse, something that sticks to you. And when that happens, we have this whole list on your handout as to what organs process this trauma load. All right. And this is based on basic physiology, also Chinese medicine. There's a whole world of trauma-informed care in which we know how the trauma will stick in your body. So for example, the adrenal glands, which sit on the kidneys like little hats, they process stress, they produce stress hormones. The kidneys will process fear. This is all in your handout. The kidneys will process anger. The heart, obviously, love/hate. Lungs will process grief. So basically every organ, and again, you're going to get 2 handouts about this, are there to process emotions as well as what they process physiologically and structurally. So even if you have a car accident or a concussion or whatever, your body will still go into a similar trauma cascade as if you've had something, a grief or something happen to you. It's kind of a similar trauma cascade. Basically, your organ systems will start to load with the response to that trauma. And this is something that they are designed to do. Your body is not doing anything that it's not supposed to do. When these certain things happen to you, your body will have a response to those things because you live life with every cell of your body. The problem is that when you're loaded up with too much trauma. So I have a client now who came in with significant complex regional pain syndrome. She's very had very difficult functioning in every possible area. But doing a deep dive on her history, she has a congenital issue around her ureter, which is, we'll talk about those in a minute. We do a lot with the ureters. And this was something that has been there through her whole life. And she grew basically on a problem in a major organ. She also then had a car accident when she was 8, in which case she was wedged between 2 seats, which is very no bueno for a neck. So it's a matter of load. So when we have our hands on her, we're trying to figure out, okay, why are you in this paradigm, in this situation? What happened to your body and where is the map? So the map was all to her neck, from all the trauma to her neck, which on most imaging is clean. And then, but fascia, it is not clean at all. And then we have the ureter problem. So then when we treat her, we are going to treat the areas that come up on the fascial map. And we start to kind of get things to shift that way. Again, we're looking for a load. Anyway, so going back to the trauma handout, your body will start to respond to the trauma based on how it's designed to do that. The adrenals start to do that right away, and they will put you into a fight or flight situation. We're all familiar with what that feels like, right? So if things continue, your body will start to load. Your diaphragms will load. Your kidneys may load. Stomach processes everyday stress. That will load. The tissues become more and more burdened. They're tighter. They start to load in. Over time, if the body cannot shake this off, you end up with your vagus nerve becoming activated. Everybody's familiar with the vagus nerve. It's getting a lot of press these days. And the vagus nerve is an extremely important cranial nerve that feeds right into the autonomic nervous system. It's called the vagus nerve because it goes everywhere, comes through the brainstem, goes into the dura, around the ear, through the neck. There are branches that go around the aorta. It's all throughout the chest. And then a main branch goes through the diaphragm with the esophagus. And what can happen is that nerves can be crushed. It's called a crush on a nerve. So we follow what's called the osteopathic rule of the artery, in which case your body will always protect your cardiovascular system more than anything else, even at the expense of your neurology. And the poor vagus nerve, which is coming through the diaphragm with the esophagus, with the aorta, and, you know, this very important area, all these diaphragms that we work with, and poor little Mr. Vagus nerve can get smooshed. And if you're under so much tension and unhappiness, he gets a little smooshed and he starts to scream. And that is when he goes into dorsal vagal. So dorsal vagal is when a certain branch, a nucleus of the vagus nerve becomes activated. And now you're in freeze or disassociation. Or fawn, which is another one apparently that they're coming up with. They keep coming up with more F's: fight, flight, freeze, or fawn. Oh, flock. That's the newest one I hadn't heard about. That one, flock. I was like, all these trauma things that people do. All right. So once that happens, someone could be in a beautifully designed dissociative paradigm. And the goal is to kind of help you come out from there. If that continues, then all the information can work its way up into the limbic system, which is that survival part of the brain. And now you can be in a limbic mediated defense mechanism. And again, this is all in the handout. And this goes through something that are known as the limbic mediated behavioral mechanisms, which our patients sometimes shoot in our direction because everybody does that sometimes. So there's a whole list on here of when your brain is now hijacked into a survival crisis and will exhibit behaviors that are being mediated by the limbic system. So some of these are affectation, confrontation, shame, victim, martyr, self-pity, self-righteousness. These are not necessarily personality types. These are limbic mediated defense mechanisms. And when somebody comes in exhibiting these, we know that they are in a survival situation, and we work to bring them out of that. All right. So basically, when clients come in, the presentation that we see, we assume is the body doing exactly what it's designed to do. And our job is to figure out, okay, how do we help them? And we do that by starting to deload whatever tissue is mapping and loaded. And then we give them processing handouts, which you have as well. So there's more detail in the handout, but I just wanted to get to the processing handouts because they're kind of fun. So you have one for physical trauma. And so this was developed by my mentor, who is a brilliant genius, Sharon Weisselfus Giammatteo. She was extremely smart. And like all of us, she was trying to figure out how can we help patients heal better and deeper and quicker and faster and safer. And what she noticed, and I'm sure she's not the first person to notice this, but she had a very, very clear way of thinking about things. So when she noticed something, she tended to research it, and then it kind of grew from there. When you touch one part of the body and then you touch another part of the body, you are creating a circuit. And our bodies are designed to respond to touch. This is like a big duh, right? Okay. But that can happen therapeutically, as they say. So with our clients, what we noticed during treatment, because of all the fascia release that we were doing and yada, yada, is that when you connect two parts of the body together, you can change or override what the body was previously doing and try to get it to do something else. All right. Your body is designed in a beautiful way with an extremely complex array of vasculature, lymph, organs, all of this. But everything's regulated by your neuroendocrine system, by your autonomic nervous system, sympathetic and parasympathetic, by your glands. So it's an exquisitely well-regulated system. All right, in terms of systems theory, systems dynamics, it's a closed mechanical system. Therefore, it's self-regulatory and self-healing. So whatever we see when the client's coming in, we're like, okay, why is the body doing that? We never assume the body's doing anything wrong. We always assume, okay, what's going on here? And what is this telling us? And what can we do to help? So your body is running on a paradigm of information, physical information, chemical information, emotional information, thought information, but it's all information. And what the team realized was that if we put our hands on, we could give the body tactile information to try and override whatever information put them into this crisis in the first place. All right. So as physical therapists, we run on physical touch. We are boots on the ground, physical. And we realize that using the hands, you can change and work to reset when the body goes into these autonomic nervous system states and shock, all these things. So I've, again, been doing this for quite a while. I've been fully immersed in this way of treating for over 20 years. And this is one of the most significant contributions that my mentor made in manual therapy, that you can change. You can bring somebody out of shock. You can bring somebody out of PTSD. You can bring them out of POTS. Like, we love POTS, freaking love POTS. I can work on POTS every day because it's a structural dysautonomia that the body went into because it was protecting the cardiopulmonary system. And if you figure out why the body's doing that, you can reset the POTS. It's fabulous. All right. So everything that we do here in the clinic is all about what can we do with our hands to help the body in terms of what is it trying to do, what's going on, and what can we do about that. So if you look on the physical processing sheet, on the second page, it gives you a list of the process centers that we use most of all and what they're for. All right. And a lot of these, if you know how the body works, they're kind of obvious, but you may not know that. So this may be new. So the ureters, which are the tubes that go from the kidneys to the bladder, they are muscles and they drain fluid. They drain. That's what they do. They drain. So when we are trying to get a part of the body to drain, we take it to the ureters. We put a hand on that part of the body and the other hand goes across the low back on the ureters, and it sets up an immediate connection. And that part of the area will start to drain. We've seen this countless times in the clinic. We've done little trials with one leg that was operated on and the other. And it's fabulous. This is our first aid for anything that happens to you, is you take it to the ureters. All right. You're telling your body, I need you to drain this. Come on, let's go, let's go. You're giving the body more input and more information to do what you need it to do. So the ureters are usually one of our go-tos for homework. And again, they're for drainage. You can use the back of your hand. It's very hard to do that with the front of your hand, obviously. So you can certainly use the back of your hand there. The frontals, again, the frontals across here, this is for memory neurological processing, we use the bridge of the nose, number 3, the frontal nasal junction, to access that limbic system. All right, so the limbic system is the survival part of the brain that will become activated when you are in a survival crisis, and also certain times of the world. Oh, just saying. All right, things can be happening around you, and it's like, ah. All right, if you feel yourself, ah, that is your limbic system going, ah. All right, and we access that from here. And so we'll say you can take it to the ureters, a hand on the limbic system, a hand on the low back, and that will start to drain things a little bit for you. Parietals, this is sensory motor. So often if somebody has a chronic pain situation, we may try and get it through the parietal bone and lobe if we can get it from there. Thyroid obviously does a lot with, it's part of the endocrine system. It does a lot with your controlling of metabolism. Heart, number 5, is in your chest. And often we use that as part of our first aid. So if somebody has a bonk, if they bonk their head or break their arm or something, we say, take it to the ureters, take it to the heart. Because what you want to do is you want to drain the area and try and normalize the circulation. All right, so it'd be one hand on the area of a problem and the other hand would be on the ureters or the heart. And we usually hold these for about 20 minutes, which sounds like a long time, except that when you start doing it, it feels really good. So I tell my clients, this is your official, you can watch TV and not feel bad about it because you're doing your processing. It's okay, it's fine. So, all right, lungs are on each side of the chest, on front and back. They're obviously for oxygenation. Spleen is on the left side in the lower rib cage. It's actually around rib 8. That has a lot to do with your immune system. Your liver is under your ribs on the right side, on the lower ribs. And that has a lot to do, obviously, with detoxification and immune system, many, many things that the liver controls. And the pancreas is kind of under your, on your belly, across your belly button. We are getting to the mind body part, I promise. We're doing the physical part first. And then the kidneys are in the low back, under the ribs. And then the last one is like prostate, uterus, low pelvis. So if someone has a problem that they're dealing with that is physical, we will give them the homework of taking that area of the problem to usually the ureters or the heart. If they're recovering, say, from like Lyme or COVID, we may have them take the area to the spleen or to the liver, depending upon what we want to process. All right, does that make any sense so far? So good, because we're going to go into the other one now, the mind body one. Good, got a thumbs up there. That's awesome. All right, the main thing to try and wrap your mind around, which I know this sounds ridiculous, but when you have hands on the body, your body is going to respond. And if you use those hands in an intelligent manner on areas that are physiologically important, you can get those areas to do something using your hands. All right. This is, again, sounding a little bit like, does that really work? It seems like it's too easy, but this is magnificent. And all of our clients do homework. They all know to do, processing on the ureters if anything happens. And this is a nice way to start to speed the process along. Using the hands like this, if you're untrained, is not the same as us working on the organ with the stuff that we do, but it doesn't matter. You're still giving the body input. And we see really nice changes with this with our clients for homework, including children. We're working a lot of kids. These are great to do on kids because kids are so malleable. All right, so your second handout is more the mindfulness one. And this is neurofacial processing for emotional release. So on the second page of this, you have all the emotions that are associated with these organs that we work with. All right. And we, again, work with some extremely complex trauma clients. And the goal when you're working with the body and trying to get things back to a better neutral is you want to move things through. You're thinking, okay, I'm reacting in a certain way because something happened that I'm not able to process. I want to be able to process it. I want to be able to okay, let's move on here. I want to move on from this, right? So again, on the first one is the ureters. The ureters are the tubes that go from the kidneys to the bladder. They're the easiest to access because they are these tremendously important muscular tubes that go down the low back. So if you have a hand on the low back, you are going to be around the ureters. All right. So what we do, the statement again is you take it to the ureters. Whatever it is that is going, you want to have one hand on the ureters, and then you want to be like, okay, you need to go. Let's move along here. So if you think about when we're children, and children feel their emotions really big, things are terrible, and then they're so happy. They go between states like that really quickly, right? And they have these really big emotions. And what is the parent's role is to help them process these big emotions. When the parent comes in, they're like, oh, okay. They're very easy to redirect. Things don't tend to stick. All right. So this is that same philosophy. We're trying to have whatever happened to you. Not that it wasn't necessarily horrible and it's not stressful. There's no negating the importance of what people have been through. But the whole point of it is that we want it to move around and not stick to you. We want it to go. All right. And our whole philosophy is the same as a lot of trauma-based mind-body clinicians. That is, if something can happen, the goal is to make it unhappen. The whole point is not that something will then, hurt you for the rest of your life. The whole goal of a lot of the trauma recovery that's coming out now, the brain spotting, EMDR, all these things is like, okay, yes, it happened, but we want it to go. We're not going to let you have that affect you for the rest of your life. Like the time for that is over. It's kind of like where we are with realizing that the brain heals, right? There are things that we thought were true years ago that are not true anymore. And one of them is that you can have childhood trauma for sure, but the goal is to make, okay, we're going to reset that structure. Between the structural resetting, homeopathics, EMDR, all of that, it's like, okay, let's get to that cellular level and reset that tissue. All right. We're no longer okay saying that anybody should stay in that for the rest of their lives. Everybody's like, okay, that's not okay. So for us as physical therapists, we work on cellular structure. And one way that we do that is through the processing. All right. So going through this processing handout, it's giving you the areas and what emotions they tend to process. All right. Now, all of these also have a positive. So the liver just doesn't process anger. It also processes your sense of will. So it's not all negative, but we just have the ones on here that you want to go. All right. So number 1, ureters for drainage. Number 2, again, frontals, thought, judgment, behavior. All right. The goal is that we should be processing and from here. You want to be working from your frontal lobes and not from your limbic system. So no judgment, but in making decisions about life, it's good to be kind of in your frontal lobe when possible. All right. So even taking that to the ureters will help it to be like, okay, we good? We good? Let's make sure we're really thinking clearly here. All right. Number 3 is that limbic system. All right. The associated emotion with this is rage. All right. Rage being the abject sense of loss of power. All right. Rage is like gasoline. It's more than an emotion. It's an energy, and it's irrational. All right. So the limbic system, I think this is on the original sheet. The limbic system by definition is irrational, symbol mediated, sensory driven, and nonverbal. All right. You cannot talk your way at like a child having a temper tantrum. You can't talk them out of it. They're sheer rage at that point. All right. They need a symbol. They need to see the ice cream. They need something that's going to, kick them out of that. They need a sensory input at that point. All right. So when you see people acting in ways that are irrational, symbol mediated, sensory driven, again, nonverbal, that person is not in their rational mind. It's not possible. At that point, they're limbic dominant. All right. We've all been in this situation, and we've all seen people in this situation. All right. No judgment. It's just that our system can only take so much. And at a certain point, the limbic system will just just take over. All right. But if you want to process that, we have hands on the bridge of the nose, and then we take that to the ureters. Be like, okay. All right. We got it. Calm down. All right. Number 4, the parietal. So the top of the head. So this is the sensory motor cortex. So we're thinking about seeing, hearing, smelling, touching, tasting. I don't use this so much for this type of processing, but go for it. It should be helpful for something. Thyroid. All right. Because it's in the throat, it tends to process issues around, your communication and speaking up for yourself, like speech out. Right. So again, we'd have a hand across the neck and then a hand on the ureters. It's amazing how many people have had strangle histories, whether it was a sibling who strangled them to torture them as a kid or older. We have a lot of clients who are very sensitive at the neck. All right, but having the thyroid process to the ureters can help open that up a little bit. Heart, obviously, love, joy, hatred, also loss of love, abandonment. So we're all familiar with the concept of a broken heart. That's like an actual thing. All right, but having your hand there, so you'd put one hand on the heart and the other hand on the ureters, and you're like, okay, let's see how much we can move this through a little bit. Let's move this out. Again, nothing that we ever work on the body negates what happened to the person, but the whole point is you're not going to leave them there. You want them to help. Okay, you gotta move. We don't want to leave you in that situation forever. That's just not okay. All right, the goal is to help people to recover. All right, lungs. So lungs are really important for air, obviously, but they also process grief and deep sadness and despair, like the will to live and breathe. All right, so lungs are on either side of the heart. So you just kind of go off to the side here, and you have several lobes. So you would just hit as many areas as you can reach there. But if you want to help someone who's truly recovering from deep grief, you need to process from the lungs. So the heart will get kind of like the loss and like the heartache, but it's the lungs that are processing that grief. All right, number 8, the spleen is a very interesting fellow, and he processes issues around the disappointment in mankind, which is kind of interesting. So all these were developed, the team in Connecticut that I trained with, but also Peter Levine, the very well-known trauma therapist. He wrote the Tiger book. What's it called? A very well-known book on trauma with the tiger in the title. So he wrote the foreword to Sharon's book on the processing. And when they notice some of these things that come from different organs, it's like, oh, it's amazing that that's something that could be held in the body, So we've worked on the descendants of Holocaust survivors. We worked on people who have been tortured. So these things, again, they'll root in your body in certain areas. So the spleen, which has a lot to do with your immune system, will process issues around being disappointed in mankind as a whole. It's kind of fascinating. So again, you would take that to the ureters. Number 9 is the liver. So again, we're talking about, again, that it's a huge organ. It's the entire right side of your rib cage, your lower rib cage. As long as you're on your ribs on the right side, you're going to be on the liver. It's enormous. And the liver has a lot to do with detoxification. It has 500 things it does every minute. So it's the processes center for the body. It produces and degrades steroid-based hormone. Like, it has a lot to do with everything happening in your body. And that's one of the major organs that feeds into the blood, that sends nutrients to your body. It's incredibly important. It also will process anger. All right. So if you find yourself a little angry these days, you can try putting a hand on the on the liver and taking that to the ureters. If you're feeling like you're having angry thoughts, you can do liver to frontals to see if that may help with that. Or angry words, maybe liver to thyroid. There are many ways you can mix and match these, whatever you want to do. But again, we're structurists. So for every thing that you see walking around, there's a structural correlate to it. All right. So on our planet, structure dictates function. So whatever is going on with you, it's like, okay, what artery is it? What nerve, vessel, organ, everything. We go to like the physical root of that. All right. So same thing with emotions, same exact thing. Okay, next is the pancreas, which is a very interesting organ. The pancreas is in many ways the immune bridge between the spleen and the duodenum. It has a lot to do with, obviously, insulin, but its more important thing that it handles is immune. It has a ton to do with your immune system. And when the pancreas is out, as you know, it's kind of game over. So the pancreas is extraordinarily well protected. It's retroperitoneal, and it has many ways that it's working with other organs. So you have your common bile duct goes through the head of the pancreas. So it works with the stomach, with what's going on, those fluids in the duodenum. It's a very, very, very interesting organ and is extremely important for issues around life. So in our paradigm, what we've seen is the pancreas will be loaded in issues of true shock of the level, like shock to the level of humanity. So we see it in a lot of first responders tend to have very loaded pancreases. We've seen this in all of our clients who are descended from Holocaust survivors. We call them the hanky-pankies because they all had, it was a group of women, they were all Holocaust descendants, and they all had pancreases that were like totally loaded. So things that are truly shocking to the level of humanity will get you in the pancreas. It's an absolutely fascinating organ. So for that, you'd put a hand over the, usually around your belly button. It's a pretty large organ. It goes from the duodenum all the way up into the spleen. So as long as you're around the belly button, you should be on that pancreas, and you can take it to the ureters. Next are the kidneys. So the kidneys are super fun and actually pretty easy to access because they're right under your ribs in the back, and they process fear. So think about how often what's going on in terms of that poor little vagus nerve, because all these tissues around the respiratory diaphragm will start to load, and then the diaphragm locks down and clips right on that vagus nerve. So he's very vulnerable. All right. So again, we see a lot of fear with our clients who have been through extensive childhood abuse and trauma. They usually come in with in a limbic state. So usually we start from the top down and start to drain limbic system and then adrenals, and then the emotions start to come up. When we say take it to the ureters, okay, take it to the ureters means one hand is on the area that you want to process, and then the other hand is on the ureters. I mean, so taking something to the ureters means your hands on the ureters, and then the other hand is being connected to the ureters because your hand's on that area. And that creates a connection to the ureters, and the ureters will start to, you'll feel it. You will feel a connection. It's actually really interesting. We've done trials when I had neurofeedback in my office. This was years ago. And we'd have kids connected to the like the EEG leads, and we would do processing on them, and we would see changes in the brainwaves as we did it. It's fascinating. This is one of those things where it's so easy. It's like, how could that even do anything? But it's like so easy, and it's so effective for sure. So back to the kidneys again. When we're working with someone and bringing them out of a trauma situation, we'll start, draining limbic system, draining adrenals, and then the actual emotions will start coming up. And then in combination with an actual therapist who they'll process those issues with, we will drain and work to reset those structures. So the philosophy that we have is if it can happen, you can make it unhappen. You just need to know how to do it. And love is always stronger than anything else. So we don't care what happened to them, whatever terrible person hurt them. We're like, the love of your practitioners is way stronger, and we are way smarter also. And we can figure it out, and we can reset you. That is our driving philosophy for our office, is whatever happened, we're going to fix it.
Hey, friends, I gave you all rights to unmute again because I recognize everybody in the room. So if anybody has any questions that they'd ask directly to Lisa, feel free.
Great. Are we okay on time? Because I've got just a couple more to go over it. We're good?
It's up to you because
We're good?
we're supposed to end at 3.
Oh,
But
okay, we're good.
okay, but we're good. Okay, go ahead.
Oh yeah, that's fine. That's perfect. Okay. Okay, so kidneys, fear comes up a lot. So people feel fear a lot. So when we're processing the kidneys, you'd have the back of your hand on the kidneys, which are under the lower ribs, and then your other hand just below that on the ureters. It's obviously not as comfortable to use your own hand. So if you have somebody with you, they can always do it this way and kind of hold those organs for you. We have people coming in who bring in their spouses often. So we'll have the spouses trained in the processing. It's really helpful. Animals, cats, there are helpful, but you kind of need a human hand on there. So just having your cat on your chest, although it's very therapeutic, obviously, it's not exactly the same. Okay, getting down number 12, prostate uterus. So we're looking at the tissue right behind the pelvic bowl and floor. And that usually deals with issues around sexuality, gender, reproduction. It's also getting into that first chakra. So the first chakra is all about safety. Am I safe in my body? All right. So a lot of what happens with trauma, abuse, neglect, all of that is the person no longer feels safe in their body. And a lot of what we work on, and then traditional trauma therapist is no. Step A, you have to get them to feel safe in their body. All right. So a lot of this, when you work on mindfulness and moving things out of you, you also want to work on, okay, how do I want to be feeling in my body? Like safe, I want to feel joy, all these things. So this also works to help those feelings get stronger. So if you want to feel more safe in your body, you'd put a hand on your pelvis behind your pubic symphysis, and then the other hand can go on the ureters, and that will normalize. Let's say, okay, I want to feel grounded in my body. I want to feel safe in my body. Same thing if I want to feel more joy, you have the hands on the heart, and you could take it to any of the other process centers. A lot of these organs love being touched. They love attention, and you feel it when we're treating, every organ that you have, it's like you're part of a village. Or I have a video that it's about like, I'm like a real Andy Cohen moderating a Real Housewives reunion. Like your whole body is like a big cocktail party, and everybody should be happy. All right. Like the lungs should be draining, the liver should be, everybody should be happy and communicating and doing their job. All right. So when things go awry, it's because there is something preventing the organ systems from doing their job. And whatever that is, it's a form of load. Is it physiological load, energetic load, whatever load, but it's load. And one of the things that the processing does is it moves these loads out of you. It starts to get things to shift. All right. So this is like it sounds very simple, but it's extremely, extremely effective. The last two, we've got the upper arms, which are kind of control of self or self-control. And then forearms for belief systems. So those can be worked with if you want to dream belief systems or control of however you want to integrate that. So yes. Thank you guys. And so in summary, basically we believe that whatever happened to you can be made to be unhappened. It's just a matter of figuring out what happened and how did it sit in your tissue and what can be done. And we don't work in isolation. We work as teams with naturopaths, functional medicine doctors, acupuncturists, mental health practitioners. So we work as a team with other people, especially when there's a lot going on. But I think one of the things that the really needs to shift in terms of thought is that your body is designed to heal. It's designed to recover. And it's self-regulatory, and sometimes it doesn't even need that much help to get back on track. It just really needs some assistance because things happen that were too much, right? In terms of mindfulness, if you want to be connecting with your body and with, your kind of chi and all that kind of stuff, to process all that stuff out of you is going to make that easier. Does that make sense? Like everything else that you're doing for mindfulness will be made a lot easier when these loads are kind of not in there. Is the service covered Medicare? So we are non-participating providers with Medicare. So you still pay at time of service, but yes, then we send the claim into Medicare and we charge the Medicare rate. So they control what we are able to charge. So yeah. But we see a fair number of Medicare clients. Have I worked with EDS patients? Yes, we work with EDS patients every day. So EDS is super fun because it is a matter of looking at what is going on in that connective tissue and they're in some ways more vulnerable, but in other ways more easy to work with and harder to work with at the same time. But because our specialty is fascia, like that's like our bread and butter right there is EDS and then physical trauma. So we work with EDS, but also a lot of Chiari patients. We work with a lot of people who have had all kinds of issues in their cranium, and then tons of POTS, which goes along with EDS often. We work with the more complex clients. That's what we like. I can give more info for homework, or if you guys have more questions, or Jeanette, here we go. Long COVID patients with brain fog and fatigue. So the thing that is so fascinating about long COVID is that we have a lot of clients who we knew for a long time before they got COVID, and then they got COVID. And so it's been a great learning experience for us to see what happens. So the immune system is incredibly complex. And just how I was talking about how the body is organized by, cardiopulmonary, cardiovascular, everything in your system, but you also have a lymphatic system, and you have these neurolymphatic reflexes, you have vascular reflexes. So what we're noticing is that whatever you had, it's kind of like with Lyme, whatever you had going on before the COVID gets you in your fragile area. And that's an area that then has a harder time recovering from what happened from the COVID. And it needs to be reset. Plus the immune system needs to be reset. So we have a client who had polio. We've known her for quite a long time. She was doing amazing. No post-polio syndrome. She's been doing fantastic. Like she's done great. And then she got COVID in last January. And what we noticed was all of the reaction of her body that her body had originally had to the polio in terms of the neurolymphatic reflexes, diaphragms, like how her body had gone into this really significant lockdown was replicated from the COVID. So you don't often think about the lymphatic system as being neurological, but there are these literal like neurolymphatic reflexes where your lymphatic system is tuning right into the autonomic nervous system. So a lot of what we do for the long COVID clients is help get those systems reset so the drainage can open, and that's for the brain fog and the fatigue, and try and get everything back to normal. Your body has a whole watershed system that it works on to control what is going on with your fluid flow. And what will happen with Lyme, COVID, a lot of these different things, poisonings, heavy metal, all these different types of toxicities, is those areas will lock down. And again, we work with, really top level naturopaths, functional medicine doctors, and they do the physiological piece, which is great. But a lot of those structures need to be reset manually as well. And there is no drug that's going to open up your diaphragms for you. It just doesn't work that way. So for us to go in and manually reset, we have techniques to reset every lymph node in your body, but it's more getting into those neurolymphatic vessels, reflexes, and getting everything to reset to how it was before the COVID. Again, our whole thing is like, whatever happened to you, we have to figure out how to get you back to like where you were before. And to do that, you have to work on the entire inflammation cascade and the neuro cascade and the lymphatic cascade. We do. We have worked with a fair number of cancer clients, and our goal with that, it's same with actually with our Lyme clients, is to make it, we're like the manager in a wrestling ring that we clean you off and push you back in the ring. Basically, the goal is so that your body can withstand the chemo, just like with our clients going through like Lyme treatment. We've had many clients go through extensive, very, very intense Lyme treatment, and you need to be continually reset to make sure everything's open. Talk about ureters, shock. So with all of our clients going through active treatment, our goal is to act as like the coach and basically like, okay, let's reset you up, and then you go in again. Let's reset you up, go in again. American medicine is not, it doesn't look at structure. And this is a major problem. Like, it's a major missing piece. So like, everybody going through cancer treatment should be continually getting their fascia reset so that you make sure your body can withstand the chemo. Right. So we've seen this with, we've treated patients who are very ill, and we've had patients, we did some work with the GW, their support group there, because we had a client who was in that support group. And what we noticed was that our client did amazing. She's like out in the country, she's doing this. So the patients who work with us had a better quality of life, and they were able to withstand the treatment better. We've seen that with our Lyme patients for years as well. So yes. So yes, a drug like physio, all that's great. But again, a huge missing piece here is the fact that your body is structurally oriented. And if you're not also resetting the structure, you're leaving a huge amount of recovery on the table. So that's kind of where we come in. And again, the work that we do is much, much more similar to European osteopathic medicine than American PT. We're trying to make that change. We're trying to help everybody know who we are and what we do. So we're working on it. We're working.
They're working hard, everybody.
Yeah, we're working
Do
on it.
yourselves a favor, go over to Lisa's website, her practice website. There's a lot of amazing information on there.
Oh, thank you.
You're welcome. And does anybody have any more questions for Lisa? Because I know we could keep Lisa here for longer, but I don't want to be greedy. So, Jen, go ahead and unmute yourself if you have a question.
I was just going to ask you the extent to which you work with people in medical training, because it seems like medical training is moving away from hands-on touch as a diagnostic mechanism. And that concerns me, but I'm old and, was around when people actually did kind of.
Yeah, it's a problem. So for us, we just had an intern do her practicum with us. She just got her master's at Georgetown. They have their integrative health sciences program. And it's a lot of kids who are then going into medical school. So in as much as they're getting more integrative, they're getting less hands-on, which is kind of like, how's that possible? So again, my classes are part of a diploma program at a university in Venezuela. And we treat a lot of doctors, and they're all like, what the hell are you talking about? They have no idea what I'm talking about. And I'm like, ugh. So we have a lot of things that we're planning to do in terms of teaching. We do have classes for doctors that we've done. But yeah, doctors like don't know, generally, because our company is run by pharmaceuticals. No judge. I mean, it just is. Our country is like a pharmaceutical situation. So what we are desperately trying to do is help people to know that there's an alternative. We are launching our classes online. We have a lot of stuff we've been working on to help people to know what's out there. And we're not the only ones doing this work. I think we're really good. But but yeah, manual therapy in the field of PT actually, ironically enough, is getting more traction because the consumer doesn't want, it's like, if all my options are meds and surgery, that's ridiculous. And like, there's a whole world of manual therapy out there that can really help a lot of things. Yes. I have somebody in Philadelphia who I can put her name in here. I trained with a woman. I've taught all over the world. We had people it was fantastic. We had a whole thing going on here, and then she got sick and the whole thing kind of fell like a house of cards. So I've been on my own now for a while, but it's taken me this long to really understand why this stuff works. And now we're kind of getting ready to blow up our teaching more, because the consumer really wants something different. And, with baby boomers aging, like, people are just like, this can't be drugs and surgery. This is ridiculous. People are really craving a change. I don't know anybody from my training in Baltimore, but Brian Tuckey, so he does the fascial counter strain, which is similar to what we do. He's outside of Baltimore. somewhere. I'm not quite sure where he is, but he's outside of Baltimore somewhere. But yeah, so again, there's a world of manual therapy, a world. And we really would like to see that put more into medical care. We're treating like a high-level Lyme doctor right now. And whenever I talk to him, he's just like, what are you? I'm like, how do you not understand what I'm saying? This is all physics. But they are not taught physics. They're only taught physiology, which is totally fine. But POTS is a structural problem. All right, you're not going to fix POTS with medication. You have to actually reset the diaphragms to fix POTS. So there are a lot of things that are happening, that need to happen. So do we take, we're non-participating providers with Medicare, so patients still pay at the time of service, but we do submit to Medicare. And we, like I'm teaching this weekend, we don't use outside people for demos because we don't know what's going to happen and it's not really responsible for us to do that. So, but we are trying to figure out ways to get people to come in so that people can have more of like a low cost treatment option with us. Again, we came out of insurance years ago because we see people for an hour and like we're not a volume practice, so we can't take insurance, but we're always looking for ways we can give more care. I have 3 offices. So my main office is on 16th and P. That's where I'm now. And I have an office in Herndon and one in Silver Spring. So, but yeah, it's, especially if you're more integrative minded, which I think most of you are on the call. Like, again, the goal for integrative care is you figure it out. Like whatever happened, you take the time and you figure out what happened and you fix it. And if you can't figure it out, you send them to somebody who can figure it out. Right. So when we have patients come in, we may not be the primary, but we've had patients come in that we're like, you got Lyme, and we send them to a Lyme doctor. Or, we have a client in the NIH COVID study right now. We send clients to acupuncture, naturopath. So it's about working as a team with the other health providers, which usually include, again, we're structure, somebody for physiology, and somebody for energetics. And then you have all your bases covered. But a lot of the stuff that is very effective, I mean, this homework anybody can do. It costs nothing. And it will start to get things moving. Like, it's remarkable what the homework can do. We treat tons of kids, and kids are extremely malleable. And there's a lot you can do on kids that, cost nothing because you just do the processing. So, yeah.
All right, so I think we should wrap this up
Okay.
because it's 3:02 and I don't want to take advantage of you. Thank you for the handouts.
Of
I've
course.
I've made sure that people had the link several times here in the chat, but it'll also be in the after event email, everyone. Um, Thank you for taking the time to just educate us and enlighten us and just really inspire us, Lisa, because
Yay.
a lot of things that you tell, absolutely, whoever just sent the heart, I'm right there with you. Okay, everybody have a wonderful weekend, and Misha will be back next week.
Great. Thank
Bye.
you, everyone.